Today we're going to be learning about the ward level inventory management system. So first thing we're going to do is register because we don't have an account at this point. So in this case we're going to use tutorial at example.com and then choose your password. And then you're going to pick which work location you work in. So in this case we'll pretend that we're in the maternity ward. And then we'll just enter first and last name. We'll use John Doe here. And then a phone number. And once you hit sign up, your account will be created and you'll be redirected to the login page. So here's the login page, and then we'll enter the email we just created, and then password. And then when you hit login, sorry for the pop-ups there, you'll be taken to the analysis page. So this is the inventory analysis page of your ward itself. So first we have expiring inventory. So we have our location in the maternity ward, and then we have an option of 30, 60, or 90 days. So we'll pick 60, and we'll go and get a list of all the medicines that are going to expire in the next 60 days. And you can see there's different pages there. If we go back, we can see an inventory status snapshot. So you pick your date. So this is today's date. It'll default to that, but you can pick any date. And if you hit go, it'll take you to a graph of all of the inventory that you have in the ward and how many that is. And next is inventory history. So if we go to maternity ward, and then you can pick what supply you want and what kind of days, so you can do all time and go. And this will show you kind of a straight line graph. We're going to go back and see if we can see it's all supplies all time, so all supplies the past 60 days. It'll still show you a lot of inventory, and if we zoom in you can see a little more detail there. But let's go with this at 60 days, and you can see something you would normally use in the last 60 days a little more clearly. So that is the inventory analysis. That was that button there. So we're going to go to inventory now. And to search for inventory, you type in your supply name. So here we'll do pregnancy test kits and search that. And that shows you how many pregnancy test kits are in the ward at that time. So if we go back, you can also search by supply category. So we'll do diagnostic kits. Thank you, computer. And that's how many diagnostic kits are in the ward of each type. So if we go back, that's the inventory search page. If we go to order builder, and let it load, we'll see some supply trends. It's a graph of that there. And then supplies, there's a list of supplies that you would maybe want to order less of this time, and supplies that you need to order more of this time. And then down here is the supply builder itself. So you type in how many of each medicine you want and submit order, and that would be sent to the main store. Now here for patient tracking. So this is the page you would go if you wanted to add a new patient or discharge a patient. And you can see all current patients there. To add a new patient, we go first name, last name, date of birth, their email, their phone number, and their gender. And then to add patient, you'd click the add patient button down here. To transfer inventory to a specific patient, you'll do first and last name of the patient, and then there's a drop-down list with all of the supplies and medicine. And then hit the transfer inventory. To admit and discharge a patient, to admit a patient, first name, last name, and then to diagnosis, and then hit the add patient button. To discharge a patient, first and last name, and then discharge the patient, and that's the patient tracking page. And then we'll log out, and you'll be redirected to the login page. Thank you.